I was first diagnosed with dementia 10 years ago next month. This motto, nothing about us without us, we think was first used by other sectors of more traditional segments of the disability sector. So we didn't invent it, but we certainly picked it up and proudly carry it to reinforce that people with dementia should be involved in anything that concerns us. In 2013, a group of 8 of us, all living with a dementia diagnosis, started getting together by video conference software on the internet and talking about what we could do to help, improve quality of life for everybody that lives with dementia, how we could start an organization that focuses solely on what our priorities are and not what anybody else's were. And so then formally in January of 2014, Dementia Alliance International was born, and I was one of those 8 founding members of the organization. A dementia-friendly community is a place where people living with dementia are supported to live a high quality of life with meaning, purpose, and value, and where they are included in every conversation about them. DFCs are about human rights, disability rights, equal access to our community, equal inclusion, autonomy and equity, and dementia-enabling environments. This will mean equal access to our community, to health care, to a diagnosis, and to non-discrimination, reducing stigma, and also to dementia-enabling environments in the same way that we provide wheelchair ramps and other devices that help facilitate other disabled people. It is widely recognized that people living with dementia are frequently denied their human rights, both in the community and in care homes. Many of us receive little or no care after diagnosis, and even receiving a diagnosis can be extremely difficult. So if we manage some of the symptoms of dementia as disability, especially when a person is diagnosed in the earlier stages of the disease, they are more likely to be able to maintain independence for much longer. Again, evidence is now emerging that this is in fact true. 2015, demand for a human rights approach to dementia globally. The WHO worked in record time to prepare a draft paper with consultation from all key stakeholders, including Dementia Alliance International, on a global action plan, a public health response to dementia. 2017, the WHO adopts Global Action Plan. The global plan aims to improve the lives of people with dementia, their families, and the people who care for them, while decreasing the impact of dementia on communities and countries. In real terms, what this action plan means may be different in individual countries. Since the 2000s, diagnosis is occurring much earlier in the disease process in many, many cases, but health and care professionals are still applying later stage disease management. We are just changing in ways the rest of you aren't. We have increasing disabilities, and the sooner it is looked at that way, instead of stigmas, misunderstandings, and complete lies, the better for all of us living with dementia. We desperately need others to enable us, not further disable us.